I would like to introduce the fingertip-phaco, a novel technique for the nucleus dividing hook manipulation using fingertips. Bimanual cataract surgery is an efficient procedure, but skillfully using a nucleus dividing hook or chopper with the non-dominant hand can be challenging. Therefore, by utilizing the hook with the fingertip to perform simple and patterned movements, all intraocular manipulations required for cataract surgery can be executed more controllably. Furthermore, employing the fingertip may enable delicate and precise handling of the hook, facilitating the detachment of the nucleus from the epinucleus. This approach enables surgeons to perform cataract surgery while directly visualizing the properties of the nucleus, which in turn permits accurate positioning of the hook on the nucleus. Consequently, by introducing fingertip-phaco, a novel hook manipulation technique, cataract surgery may be performed more safely and efficiently. Moving the nucleus dividing hook inserted through the side port during cataract surgery, the manipulating hand must rotate around the port as a fulcrum. This rotational movement around the fulcrum is important, and fingertip-phaco manipulates the hook using a unique rotational movement. I will show you the intraocular manipulation of the hook. If you want to move the hook tip to the right, you need to move your hand to the left, and if you want to move the hook tip to the left, you need to move your hand to the right. To perform these opposite movements, many surgeons use their wrist to manipulate the hook. When using the wrist, to move the hook from A to B inside the anterior chamber, you need to move your wrist from 1 to 2, which requires a movement distance about 10 times the distance between A and B. On the other hand, with fingertip-phaco, the distance between the fingertip and the fulcrum is short, so surgery can be performed by moving the fingertip by a few millimeters. Moreover, the human fingertips contain a higher density of motor and sensory nerves than the wrist, allowing for more dexterous movements. I will introduce the hook manipulation of fingertip-phaco that makes use of the characteristic of the bent shaft. When the hook handle is rotated left and right like a screwdriver, the hook tip moves left and right. By rotating the hook handle to the right, the hook tip moves right. And by rotating it to the left, the hook tip moves left. Let me explain in more detail how to move the hook with your fingertips. Manipulation 1 moves the tip diagonally along the inclination of the shaft to move the hook tip back and forth and up and down. Next is manipulation 2, which is used as an auxiliary maneuver to freely move the tip to any location inside the eye with manipulations 1 and 3. By changing the inclination of the hook handle toward the hook tip, the port becomes the fulcrum for the rotational movement. Manipulation 3. If you rotate the hook handle vertically, the hook tip will rotate horizontally. This manipulation rotates the nucleus and moves pieces of nucleus left and right. If you tilt the hook handle and rotate it, the hook tip will move up and down. This is used when moving the tip deep into the lens. I will demonstrate how to hold and manipulate the hook in fingertip-phaco. Extend your hand as if you are shaking hands and stabilize it on the patient's face. Hold the handle with your thumb, index finger, and middle finger, with the index and middle fingers slightly apart. Adjust the inclination of the handle using your thumb and middle finger. If you rotate the handle with your thumb as if rolling it over your index and middle fingers, the hook tip will revolve. Similarly, by changing the inclination of the handle and rotating it, the tip will move up and down. I will show the anatomical characteristics of the crystalline lens to understand the surgical technique. The crystalline lens is composed of the lens capsule, cortex, epinucleus, and nucleus. But it is difficult to identify the nucleus just by observing it under a microscope. The basic phaco-chop technique for cataract surgery involves emulsification and aspirating the nucleus while imagining the size and position of the invisible nucleus. The nucleus is divided by blindly inserting the hook into the epinucleus and moving the hook toward the center of the nucleus. With this, the nucleus can be divided if the tip of the hook happens to hit the equator of the nucleus, but there is a high probability that it will end up being a miss. After all, the surgery may be easier if you actually observe the nucleus while performing the phacoemulsification. Let's understand the anatomy of the nucleus to make it easier to divide the nucleus. Since the nucleus has fibers running radially, if a crack appears in the nucleus along the fiber direction, it can be divided. Even if only the epinucleus cracks, the nucleus never divides. Also, if the hook is used to accurately push the cut surface of the nucleus and rotate it, the nucleus can be easily rotated. But even if the epinucleus is rotated, the hook may move inside the epinucleus and the nucleus may not rotate. Regarding the manipulation for dividing the nucleus, this is performed using a hook and a phaco tip with both hands. After inserting the phaco tip approximately 1 mm into the nucleus, using ultrasound oscillation, follow these steps. 1. Advance the hook to separate the nucleus from the epinucleus. 2. Rotate the handle to the left to move the tip downward, close to the equatorial region of the nucleus. 3. Press the handle with your middle finger to make contact between the tip and the nucleus and create a crack. 4. Use your dominant hand to push the phaco tip forward to assist in the division of the nucleus. As shown in the video, when the hook separates the nucleus from the epinucleus, a gap is created, revealing the outline of the nucleus. Use this as a reference while observing the nucleus under the microscope to perform the nuclear manipulation. The fingertip-phaco technique will be explained by watching a video of an actual surgery. Check the rotation of the hook by observing the movement of the pattern on the handle. The epinucleus is dissected with the hook, and by rotating the hook, the tip is moved to the equator of the nucleus to create a crack in the nucleus. The phaco tip is then pushed forward to divide it, and the hook handle is turned to rotate the nucleus. The nucleus can be easily divided by simply touching the hook tip to its equator. The divided nucleus is aspirated with the phaco tip, separated from the epinucleus, and emulsified in the center of the bag to prevent damage to the posterior capsule. To facilitate the separation of the nucleus from the epinucleus is held down with the hook. The following 3D video shows cataract surgery using fingertip-phaco technique and synchronized hand movements. You can see that the hook is being operated mainly with the fingertip of the non-dominant hand. A small piece of nucleus remaining near the main port are caught by the hook tip by turning the handle to the right, and then the handle is turned to the left to move the nucleus to the center of the bag and emulsify it. Conclusions. Fingertip-phaco may represent a significant advancement in cataract surgery, promoting improved outcomes through greater precision and reduced risk.